Back here on Open. Glad to have you sharing with us. And as always, we continue to bring the news, the information, and the content that you need to have, particularly in a season such as this, as New York City and the state really tries to navigate through COVID-19. We've had a variety of different guests on our show, and we're glad to have this very special guest sharing with us too. He comes to us out of the 33rd Senatorial District here in the borough of the Bronx, New York City. None other than Gustavo Rivera. And thank you so much for being with us and sharing with us, State Senator Rivera.
Pleasure to be here with you.
Yeah, so let's get right at it. We know the governor's extended the pause through April the 30th. Your thoughts, first of all, on the initial move by the governor?
Well, I believe that the period is up until April 29th, but it doesn't matter one day on or off. We're talking about the rest of April. That's the right thing to do. And I understand that people are, many folks have already been inside their homes for a couple of weeks. They're getting a little bit stir crazy and they're trying to figure out what's going on or what's not going on. The reality is that this is not something to be messed with. We have to look at places like Hong Kong and some places in China where they kind of took the foot off the gas a little bit too early. The reality is that this is something that is incredibly contagious. It is deadly for a large chunk of the population, and even if we're talking about 1%, and in the state and in the country, actually, we are hovering around 3% nationally. That is incredibly serious. We need to take it seriously, and it's going to have an impact on our lives. But we are better off doing this because we want to keep our lives, and more importantly, the lives of our loved ones, people who are high risk. Are older people that have diseases which make their systems compromised, or folks with respiratory illnesses. And when you think about the Bronx in particular, the Bronx, the health of people in the Bronx. We've talked about this many times on your show, about the fact that the Bronx is the unhealthiest county in the state. We are seeing the result of that. When you're talking about Bronxites, we are 3 more times likelier to die in the Bronx than we are if we lived in Manhattan, and that's during this crisis. We can't ignore that. So we should stay home. It's going to be an impactful month. It's going to be difficult, but we need to do it to make sure that we can be healthy at the end of it.
Yeah, let me balance this out with another topic of conversation, talking a little bit about impact, right? The Medicaid budget cuts we're talking about, and the budget itself. Your reflection on the budget. I know it's hard. I know that the governor's talked about New York is near bankrupt and a budget had to be in place and passed. Your thoughts on the budget and also particularly Medicaid?
Well, I'll tell you, when we think about the governor in the last month, and we compare it specifically to what's happened at the national level and the fact that the White House has been beyond incompetent. A lot of people look at the governor and said, there goes a common sense guy who is doing the right things. And just in the last couple of days, a matter of fact, he said it today as well in his press conference. He said, we can't attach a dollar figure to people's lives. And tragically, that is exactly what the governor did during this budget process. Now, it was, when we're talking specifically about Medicaid, of course, it's a public health. It's a system that takes care of 1 out of 3 New Yorkers. And it is a system that was already very much at risk even before the crisis hit, and it takes care of our most vulnerable populations. He demanded that we cut that system by up to $5 billion for this coming year. Now, we were able to push him back a little bit, but it's still going to be about a $4 billion cut to a system that is already stressed. I think what he did was immoral. It was a callous move. This is the wrong time to cut this system. I don't think there's any good time to cut a public health system, but in this particular moment, it's even a worse decision. And lastly, what he is asking us to do, when he asked us to do in the legislature, was to give him the authority to cut a system which is already, again, as I said, teetering on the edge. The people, as we see right now in the Bronx, there's a lot of Medicaid patients in the Bronx because we have a lot of poor and working class people in the Bronx. I already said that we are at a higher rates, that we're dying at higher rates than the rest of the state. And that's going to be the reality in all poor communities of color. And those poor communities of color are served by this system. So the idea that he would cut it and that he would not tax billionaires and millionaires at a higher rate so that the hit would be lessened. It's just something I cannot and I will not be silent about what the actions of the governor have been, and the fact that the system that is going to keep our most vulnerable healthy and alive, and it's going to do so with an incredible stress on it immediately after the crisis is done, is going to get an enormous cut that this governor pushed through. That is immoral, callous, and I could not vote for it.
So let me go through the reasoning why. I think a lot of people are asking the question, why were the cuts to Medicaid necessary? Why
weren't,
especially given this time?
I don't believe that they were. Listen, we can have a conversation about what he said at the beginning of this year. And I have been fighting with him on this issue on Medicaid since the beginning of the year, because even before the crisis, he proposed something called the Medicaid Redesign Team, or MRT. This was something that was done back in 2011 when the cost of Medicaid was shooting through the roof and we needed to kind of manage it. And so I certainly believe that if we're going to identify fraud and inefficiencies, that we should do that. But unfortunately, that is not what he proposed to do. Take St. Barnabas, for example. St. Barnabas is a hospital right in the middle of my district, serves over 90% of the people there are Medicaid patients. And it is a hospital that's been consistently at risk for the entirety of my tenure, right? 10 years, I've been in the Senate, and for 10 years, they have been struggling and making sure that they continue to be an incredible part of the community. What he proposed originally was to cut it by $9 million, which would have been disastrous to that hospital. We were able to fight it back. We still don't have clear numbers about the impact that it's going to be just on that hospital. But you have, if we're talking about hospitals, we're talking about nursing homes, we're talking about people in long-term care, we're talking about folks in our families and in our communities that need this care. If we're going to talk about inefficiencies, and we're going to talk about making sure that we can do the right thing with the money, I believe in that. But first of all, I believe that this is not the time to cut our way into making the system better. It needs to be a more inclusive process of people who are actually service providers, because that MRT that I described did not include a whole bunch of people, like health and hospitals, the public hospitals in the city of New York. They weren't at the table. Doctors weren't at the table. Nurses weren't at the table. Federally qualified health centers weren't at the table. And they're all going to be impacted by these things. So if he wants to get rid of fraud and inefficiency, fine. But let's do it at a time when we're not in a crisis. And for the love of God, if we are talking about cuts, could we talk about taxing wealthy individuals, millionaires and billionaires, at a higher rate so that the hit would be less on working and poor people across the state? He didn't choose to do that. This is choices that the governor has made. And we need to make sure that regardless of how good he looks in comparison to that orange madman in the White House, we can't forget that these are actions that he has taken, and we need to hold him accountable for them.
Understanding. Before we leave, let me talk to you about services in your area real quickly. For those who are in your area worried about services, particularly seniors and those who are the most vulnerable, what's available and what would you like them to know before we go?
Well, first of all, my office remains open. We are operating remotely. My team is available to you. I hope that you can put the number underneath, and that is 718-933-2034. Now, my office is operating remotely. That number will connect you to one of my staffers, and we're open to help you in any way that we can to connect you with services. As far as everyone else, I tell you, look, our healthcare system has been put under stress. Unless it is absolutely necessary, stay at home. There's a lot of times, a lot of folks in our community might use emergency rooms or urgent care centers as a way to kind of deal with their medical issues. For the moment, stay at home unless you absolutely need to, because every person that is in the system puts further stress on it, and we're already operating in a very, very tough place. But ultimately, this is what the message that I want to leave you with. I'm not from the Bronx originally. I was born and raised in Puerto Rico. I came here in 1998. That was 22 years ago. And the reason I fell in love with the Bronx is because of the resiliency of its people. When we think about the fact that at the end of the 70s, during the 80s, and certainly up all the way up until the 90s, the Bronx was not necessarily a place where a lot of other people wanted to live, but you had Bronxites who had remained here during generations because they believed in this place and they kept building even when other people ignored it. So I believe that is that resiliency that is going to get us through it. We have a diversity and we have a resiliency, which is what I've fallen in love with, which is why I'm a proud Bronxite to this day. And I would ask every one of your listeners and your viewers to hold on to that. It is going to be difficult. It is going to be terrible, but it is not something that we haven't seen before. I believe that we can get through this Bronx strong every single day. I believe it.
We believe that too, and that's what we're gonna get through this together. And so, Senator Gustavo Rivera, thank you for taking the time of sharing with us here on Open. We want to continue to stay connected to you as you continue to give us information.
Well, I'm not going anywhere. You need me, you know how to reach me.
I don't think any of us are right now. Stay
exactly.
Bronx strong. Senator Gustavo Rivera.